I'm Adele Kroch, and I'm from Food Focus, and I would like to welcome you to this webinar that we are hosting with the Consumer Education Project of Milk SA. We are honored to work with Christine and with her team, and we are looking forward to the presentation. And thank you so much, Christine, for utilizing us again to host your webinar, and we're really looking forward to your presentation. Thank you very much.
Good afternoon and good evening, and maybe even good morning to all our participants. Thank you for joining us today for this webinar, The Dairy Matrix, Health Benefits Beyond the Individual Nutrients. We are excited to share this exciting and emerging concept that explores the evolution of the nutrition science today. My name is Christine Layton, and I work at the Consumer Education Project of Milk South Africa, where we communicate the health and nutritional benefits of dairy to professionals and consumers. Before we jump into the program of the day, please note that you can earn one continuing education unit, but you need to stay connected until the end of both presentations. When my colleague will at that stage, Marietta Vermaak, will then explain to you how to access and complete the CPD article. A recording will also be available next week on the Rediscover Dairy website, and there you can also access any other information about the Dairy Matrix. So before we start, I'd like to thank our speakers, our moderator in advance, as well as the European Milk Forum for making the use of their video available for this webinar. A big thank you also to Food Focus for the administration and registration of the delegates and providing the GoToWebinar platform. I now hand over to Corina Walsh, Professor Corina Walsh of the Department of Nutrition at Dietetics at the University of the Free State, who will be our moderator for the rest of the event.
Thank you, Christine. So it's my privilege to moderate the webinar this evening. And as you've heard, it's titled The Dairy Matrix Explained, Health Benefits Beyond the Individual Nutrients. So thank you to the Consumer Education Project of Milk South Africa for making this opportunity available to us. So as nutrition science advances, we are learning more and more about the food matrix effect and its significance in comprehending the effects that food has on our health. One of the most thoroughly studied examples of the food matrix effect is the dairy matrix, which has been shown to have beneficial influences on several metabolic outcomes and systems that we will hear more of this evening. In light of the food matrix concept, we are reconsidering how we assess the health consequences of food beyond the specific nutrients they contain. An important insight from current research is that food is more than the sum of its nutrients. The concept of the food matrix suggests that the nutritional and health effects of a food are due to both its structure and its nutrient composition, and in turn also their interaction. So in 2019, Aguilera and colleagues described the food matrix as the physical domain that interacts with specific constituents of food. In the case of dairy products, the dairy matrix has been shown to have a positive effect on overall health. In recent years, the focus of nutrition science has therefore shifted from nutrients to whole foods, because foods are eaten as a whole and together with others. Consequently, dietary guidelines have also moved away from nutrient-based approaches to advocating food-based dietary patterns. These focus on the adequate intake of specific foods for their health benefits, rather than the intake of nutrients to prevent deficiencies. Let's take a look at the short video produced by the European Milk Forum that highlights this concept.
The effect that our food has on our bodies, and so on our health, is complicated. Although we have come to associate certain foods with a single nutrient, oranges with vitamin C or dairy foods with calcium, and with a single effect, saturated fat with heart health, it's much more complex than that. The nutritional and health effects of a food are a result of both the food's structure and its nutrient composition, and how these interact with each other. This is what scientists call the food matrix effect. I would like to show you what the food matrix effect is through a musical experience. Let's take 3 notes of music. Each of them played separately produces something interesting, but if we combine them, the 3 notes create a different, much more melodious, deep, and powerful chord. The resonance of these notes together produces a unique result that each note individually can't obtain. With nutrients in food, it's the same thing. This is the matrix effect. Like a single nutrient does not work in the same way on its own as it does together with other components of the food. This changes the interaction and affects things such as uptake and bioavailability, and results in something different, something unique. Let's take dairy as an example. Milk and dairy products are by their nature complex foods that contain many nutrients and bioactive components. The rich dairy matrix naturally includes calcium, protein, different fatty acids, phosphorus, potassium, iodine, vitamins B2 and B12, and numerous other nutrients and bioactive components that interact with each other. In addition to their nutritional composition, dairy foods also have complex physical matrices, from the solid state of cheese, to the gel-like structure of yogurt, to liquid milk, and so on. The interaction of this unique combination of nutrients and structure in the dairy matrix influences factors such as the digestion and the absorption of nutrients, and so the metabolic response. To sum up, like individual notes that come together to form a chord, a food's effect on health can be different from what might be expected based on a single nutrient or even a few of the nutrients it contains. This is the food matrix effect. But what are the potential advantages of this food matrix effect on health? Beneficial dairy matrix effects have been observed for cardiometabolic health, body composition, and bone health. Let's have a closer look with a scientific expert.
So to unpack the science behind the food matrix as it applies to dairy and to explain how it affects overall health, we are fortunate to have 2 experts with us today. Prof. Arne Astrup of the Novo Nordisk Foundation Denmark and Prof. Renee Blau of the Human Nutrition Division, University of Stellenbosch. It's with great pleasure that I introduce you to Professor Arne Astrup. Professor Astrup is Senior Vice President at the Novo Nordisk Foundation in Denmark and Head of the Department of Obesity and Nutritional Sciences. He was Head of the Department of Nutrition, Exercise and Sports at the University of Copenhagen from 2012 to 2020 and Chief Consultant at the Unit for Clinical Nutrition Research, Bispebjerg, Frederiksberg University Clinical Nutrition Hospital. Under his leadership, the Department of Nutrition, Exercise and Sports ranked 1 of sports and nutrition research environments in 2018. Throughout an academic career that spans over 30 years, Arne Astrup's main scientific interests have been appetite regulation, treatment of obesity, type 2 diabetes, and cardiovascular disease, and diseases where nutrition and physical activity play a role. A special focus is on the physiological effect of the food matrix on health and disease prevention. He's a highly regarded researcher. In 2018, Web of Science named him among the most cited researchers in the world. He's also interested in bridging nutrition, gastronomy, and health, and has written many popular diet books, which have been published in several countries, including the United States, Australia, and Germany. In 1996, Arne Astrup discovered, together with Professor Jens Holtz, that GLP-1 is a satiety hormone in humans. He was awarded Knight of the Order of Dannebrog in 1999 and Knight of the First Order of Dannebrog in 2012. Prof. Astrup, we thank you for the privilege of listening to your presentation today on saturated fat and cardiovascular disease and need for revision of current recommendations.
Thank you so much, Corinne, for this nice introduction. And it's a great pleasure for me really to be here and share the new data that have accumulated over the last 10 to 12, 15 years, where we really have been convinced that we need to move from saturated fat and looking at the food matrix instead. Let me first start here with my, let me see here, with my disclosures. I guess you need a couple of seconds to review them, but anyway, here's my agenda for today. So first of all, I will just take a closer look at the evidence behind linking the intake of saturated fat to cardiometabolic diseases. And we all know today that we still have some recommendations that are really focusing on saturated fat, such as the American guidelines we have here in the left panel, where we are still recommended to choose the low-fat or fat-free versions of the various foods, including all the dairy products. And also in the European recommendations, which are done by EFSA, they actually recommend that the intake of saturated fat is as low as possible. But they are outdated, and I'm quite certain that over the next 5 years or so, we will have new versions where also they will move away from the nutrient-based recommendations and moving much more into the food-based. And of course, it makes a lot of sense. Well, if we go back and look at what is the background for this focus on saturated fat, and in some way, 50 years ago, it made a lot of sense because we knew that when you increase the intake of foods with a lot of saturated fat, it would increase your blood cholesterol. And at the same time, we knew that a high blood cholesterol is actually associated with increased atherosclerosis and risk of stroke and heart attacks. So that was in some way the concept. But today we know that it's far more complicated. A high cholesterol is not just a high cholesterol, and the saturated fat is not just saturated fat. So let's take a closer look at it. Instead of cherry picking single studies, we need to really stick to the evidence-based principle with using the hierarchy of scientific evidence. And there, of course, we have the randomized trials that are the most important study for showing causal effects. And when we have several of them, we can do a meta-analysis where we try to combine all the data we have into a kind of one results. And that's actually what we want to have, also for giving recommendations for the consumers. So if we use that approach, and of course it's also the same approach that have been used for regulators, and in some way it's a little surprising, because if you look at the data that have been used, for example, by the WHO, they have used meta-analysis of randomized trials produced by scientists as Hoover and co-workers. And if we take a more close look at the evidence, not looking really at the foods, but just looking at saturated fat as an entity, so just as it's used in the recommendations, then it's based on a huge meta-analysis published in British Medical Journal and also published in the Cochrane Library, where Hooper, he included all the trials that had at least a 2-year duration, which of course makes sense if you go for hard endpoints such as stroke and cardiovascular disease. And they included about 15 studies involving nearly 60,000 people, and then looked at what was the difference between those that were randomized to a diet with high saturated fat content and those who had a comparator such as typically polyunsaturated fat. And in this predefined protocol, they had 8 main endpoints. And here they are listed, and you will see that actually 7 of the endpoints did not show any effect of saturated fat whatsoever. And these are the very most important ones, of course: total mortality, cardiovascular disease mortality, coronary heart disease mortality, the risk of fatal heart attacks, non-fatal heart attacks, etc. No effect, no significant effect whatsoever. The only thing they found was a significant effect on a combined endpoint called cardiovascular disease endpoints or events. And there they found a 20% lower risk for those assigned to the comparator. But what you also do is sensitivity analysis, and here they excluded the trials where the intervention did not produce a reduction in intake of saturated fat. And if you exclude them, which of course makes a lot of sense, just like if you have a drug trial and you have a trial where people really did not take the pills, so it's reasonable to exclude them. So when they exclude the studies that were unsuccessful, again, there was no effect. So if you take even the most hard evidence of these meta-analyses, there's no evidence left from the old days. All the new updated meta-analysis of randomized trials show that there's no effect. And this is where we have combined saturated fat from all different kinds of saturated fatty acids from different food sources and have mixed them together. So, and I think there's a pretty good reason for that, because you could start to speculate, but what about saturated fat? We know it mostly increases LDL cholesterol and therefore total cholesterol. So does it make any sense? What is in the mechanism for that? And the interesting thing is, when we measure LDL cholesterol today, which of course is the harmful one, then LDL cholesterol is actually composed of a number of different particle sizes. And what we know today is that the large ones, as you can see in the upper end here of the slide, the large ones are quite inert. They do not increase the risk of atherosclerosis. They are quite neutral, whereas it's the small particles that are the dangerous ones. And we know today that saturated fat is actually increasing the large ones. So when you see an increase in your bloodstream produced by saturated fat, it doesn't make any change in risk, whereas the small ones that are risky. And today we know the small ones are increased by intake of refined carbs and sugar. We have actually tried to convey this by doing large consortia with the top scientists in this area around in the world, where we really went into this and also, of course, looked at the nutrient approach, but also started to open this idea of perhaps we should move into nutrient-based recommendations instead of looking at just the single nutrients. And this was published in British Medical Journal 3 years ago. And I think we stimulate a lot of debate among scientists, and I can see more and more scientists are now realizing that this saturated fat concept is outdated. So if we move a little bit more into it and trying to understand why saturated fat should not be looked upon as one entity and one group. First of all, saturated fat is a big group of saturated fatty acids where you have some very short chain, medium chain, and then you have the long chain. And they have completely different biological effect, completely different physiological effect on your body. So the short chains are actually some that are very positive. The medium chains also have some positive effect. And among the long chain fatty acids, it is really different. Stearic acid is a very neutral positive one, whereas palmitic acid might actually have some adverse effect if you consume it in large amount without any matrix effect to compose it. So therefore, we really need to address the single what kind of fatty acid is it? And even more important, what matrix do they exist in? And you can see here, we have dark chocolate, we have cheese, we have etc. They all contain saturated fat. Even olive oil contains saturated fat. So when we look at them as a group, we take them from all different nutrients, and that doesn't make sense at all. So we need to move to whole foods. And we actually did another, I was leading a consensus conference in Washington, where we also had discussions with politicians and those doing the new guidelines. And we simply brought together some of the leading international experts in lipids and studies on cardiometabolic diseases and nutrition. And sorry about that. And in trying to get through with the message, we published in the finest American cardiology journal simply to get through. And again, it's one of the most cited papers that year. So I think it came out last year. So what is the conclusion from that? Well, we actually concluded that, again, some way I feel I'm repeating myself, but I think it's really important to make it completely clear that if you take all the whole fat dairy, if you take unprocessed meat, if you take dark chocolate or egg, due to this matrix, and if you do studies with them, either feed people in trials with these and compare with a reference, you'll see there's no harmful effect. And it's actually also supported by huge observational studies, population studies, where you looked at the foods and have the opportunity to distinguish between the different foods and also different versions, for example, of dairy. And I'll come back to that. Then you will see that all these studies taken together does not support any increased risk of cardiovascular disease or diabetes. And why is it so? This is pointed out by Mozaffarian from Tufts University, where he have illustrated how complex the dairy matrix is. And it's really complex, particularly if you take the fermented products such as yogurts or cheese, because the fermentation, the bacteria, they ferment some of the sugars and some of the other ingredients and produce some very interesting and biologically active end products that also have biological effects. And it means that the fermented product in itself seem to have some very positive effect, whereas if you look only at the cardiovascular disease, that most other dairy are neutral. But so you can see here, it really starts to become complicated. And so it's, of course, we would like to understand all this. We could use it for many reasons, but we can also just conclude that, well, if you have cheese or if you have fermented dairy as yogurt, they produce positive results on your bones, on your muscles, but also on your cardiovascular system. So if you have increased risk of cardiovascular disease or have established cardiovascular disease, there's no reason to avoid cheese and yogurts and eggs and dark chocolate. Good news, isn't it? I think we have, I've been involved in an international collaboration with Dutch and English scientists where we have done meta-analysis on all the observational studies where we wanted to address this in more detail because there's coming new studies up every year. So, and here you can see when we do such a meta-analysis, essentially it looks like it ends up around 1.0, and it means that it doesn't matter whether you have a lot or if you have little fermented dairy. But if you take a closer look at it, and if we split up in different dairy, we'll see that the fermented ones, as yogurts and cheese and sour milk, actually have a small beneficial effect on total mortality and risk of cardiovascular disease. So again, it fits quite well with a lot of experimental studies where we could show that cheese, for example, have some very beneficial effect on also on blood cholesterol, HDL cholesterol, and on many other inflammation and other factors we know that might be important for cardiovascular disease and atherosclerosis. Another very important topic today is obesity, overweight and obesity. And again, you know, it's really driving a lot of the type 2 diabetes and cardiovascular disease we see today, and many other complications and health issues. And if we look at what should we recommend our children to have, there was a discussion in New England Journal of Medicine about this, and I pointed this out in a small paper called Milk and Health, where I actually highlighted that that possibly, if you look at the children consuming milk, when from 2 years up to teenagers, etc., there might be a slightly higher body mass index or body weight by those consuming milk and dairy. But you really need to look at the body composition. You should not look at body weight or BMI. You need to look at body composition. And the reason for that is that dairy contains both protein and of course fat. And the protein is actually stimulating the growth of your lean body tissue so that the children utilize their genetic potential to grow, so they get a little higher and get a little more bone and muscles, and that of course can make a contribution to body weight. But it's a good effect, it's a beneficial effect, not something that is adverse. And based on the meta-analysis conducted by other scientists, you can actually see that for those consuming more dairy, they tend to have slightly lower body fat. But if you look at their fat-free mass, which is of course also bones and skeletal muscle and organs, they have slightly more. And also people going on a weight loss, if they include the dairy, they will lose less of their fat-free mass, which of course is extremely important during a weight loss diet. So even for obesity, which is a very important part of the cardiometabolic disease complex we have today, dairy is having some very beneficial effect. I couldn't dare also to share this very important big randomized trial with you, conducted by Juliani in Australia. This is a trial where they actually supplemented the elderly living at residential care with dairy. It was not dietary supplements, no, it was food. It was dairy with all the matrix, etc. And because those who had access to that, they actually had fewer fractures over the years, over 2 years, than those who didn't get these dairy. So I think it's really hard evidence that just providing them with some more dairy, which of course they love, with cheese and yogurts, etc., it actually reduced the incidence of fractures, and in particular hip fractures. And we should remember that if you are 80 years old and get a hip fracture, the risk of dying from it is about 1 out of 3 will die from the fracture. They will never recover again. So it's a very critical and serious condition. And think about, you don't need to take medications, you could actually just provide them with more dairy. And then of course, exercise, physical activity helps on top of that. And there might be, for those who have osteoporosis, you can put drugs on top of it. But I love this, that with something that simple as good food with healthy matrix, you get this effect. And you cannot completely explain it by the content of calcium and protein. There's something more in it. There is some magic in the food, and this is really great. We know obesity is a carrier of one of the reasons for type 2 diabetes. We can also see again here that the higher intake of yogurts and cheese the lower is the risk of diabetes. This is a single study. I should not cherry pick. So therefore, you also see this meta-analysis conducted by some independent Spanish scientists. And again, they really see this inverse association between intake of dairy and risk of type 2 diabetes. And they actually saw that it was both total dairy and low-fat dairy. And it brings me a little bit into the final part of my presentation, namely, should we have the full-fat dairy or the low-fat dairy? And generally it's recommended to pick the low-fat dairy, but maybe it's not really the case anymore. Well, if you give people who have overweight, which is, of course, the people living with overweight is about 80% of the population today, and maybe 30% live with obesity. But if you feed them or offer them a very healthy diet and provide them with all the foods from our university supermarket, as we did here, you will see they spontaneously start to lose weight, because this effect on satiety is much more pronounced when you feed them more protein, more fiber, more whole grain. But you also see this huge variability. And I have really struggled to understand, why is it that some people lose maybe 10 or 15 kilos without energy restriction, whereas others, they don't lose or even gain weight. We have started to find out that this is probably due to your carbohydrate tolerance. In the old days, together with Jim Hill from United States and Wim Saris, I did meta-analysis with low-fat, high-carbohydrates diet, and found actually that this recommended low-fat, high-carbohydrate diet actually produced a slightly lower caloric intake, and also over months a slightly lower body weight. So we concluded that low-fat, high-carb was good for your body weight. But later on, I realized that all these trials were conducted in healthy subjects, people who were insulin sensitive and therefore carbohydrate tolerant. Later on, I did this meta-analysis together with diabetes colleagues, diabetologists, where we found the opposite, and they actually did better on a high-fat, low-carb diet, both in terms of their blood sugar, but also in terms of their body weight. So we started to conduct trials where we looked at these high-fat or high-fat or low-fat diets, and found out that type 2 diabetics, they are carbohydrate intolerant, so that you should not feed them carbohydrates. They really benefit from lower carb with more fat and more protein. And this is really demonstrating in some way that your insulin resistance and your diabetic status is important for what kind of food you should have. And it's the carbohydrate content that is essential. And that's because, when we all digest and absorb carbohydrates, but when it comes into the bloodstream, whether it goes into your liver and into your brain is depending on the insulin action. And when you become insulin resistant, it's also in the brain. So it means when some people consume carbohydrates, if they're insulin resistant, it does not go into the brain. So they don't sense that they have consumed these calories, and they don't get any satiety or fullness effect. So they continue to consume. So it means really that this blood sugar that is maintained constantly by the brain is an important satiety signal, and it's impaired in those who are insulin resistant and type 2 diabetic. Whereas they are more heavily depending on the gastrointestinal satiety signals such as GLP-1 and PYY, where the natural stimulator or ligand of that is protein and fat. So therefore, we are moving much more into this individualized nutrition, or what we call precision medicine, telling us that all diet does not feed all. So whether or not you should have carbs or not is really depending on your diabetic status. And it means that there's a room both for the high-fat dairy products and also for the low-fat ones. This is a trial where we put people on a weight loss diet with a caloric restriction, whether it was a low fat or a low carb diet, they lost the same because it was caloric restricted. Then we subgroup analyzed the data and divided them into those who were normal glycemic, just normal people, those who were pre-diabetic, having a slightly elevated fasting glucose, and those who were type 2 diabetics. And you can see here, this is a difference between the weight loss effect of a low fat and a high fat diet. It's maybe a little complicated, but the result is that people living with type 2 diabetes, they lose more weight on a diet with high fat, low carb. Whereas those who are insulin sensitive, they lose a little bit more on the low fat, high carbohydrate diet. Whereas for the pre-diabetics, it didn't really matter. This is really summarized but it's just opening up this precision medicine, which is really a hot issue today because we now know more and more about genes and epigenetic factors, but also other traits that makes us very different. So maybe the diet that is good for me is not the same diet that is good for you. But we have more and more of these markers that can actually tell us what is the optimal diet. So to wrap up here, the totality of evidence, including meta-analysis of both observational studies and randomized trials, clearly show that there's no harmful effect of saturated fat on all these cardiometabolic diseases. And if we pick out the dairy, it's particularly the yogurts and the cheese, the fermented products, they do not have any adverse effect, and they actually have some beneficial effect of the cardiometabolic risk factors and also the endpoints. So they clearly reduce the risk of stroke and heart attacks. And even if you take a full-fat cheese with a lot of sodium, you would expect that would increase your blood pressure if you consume a lot of this. But it doesn't. It is due to the high content of calcium and also some peptides produced by the bacteria that interferes with the angiotensin system, so it will actually reduce the blood pressure. So that's the reason why it is so important to move from single nutrients into food, because we cannot predict the health effect of foods simply by looking at the label today. So I would say that we really need to open up and be more holistic in our approach and look at the whole food, because the food matrix is so important. So thank you for your attention.
Prof. Astrup, thank you so much for that most informative presentation. I'm sure all the attendees have thoroughly enjoyed it. And I have a number of questions that have come up as you've been speaking that I'd like to pose to you and hear your insight. We do have time, 10 minutes for questions, so we've got plenty of time. The first thing that I'd like to hear from you is that when you talk about high fat, low carb or high carb, low fat, could you perhaps give us an idea of the percentage of total energy that those macronutrients make up? Thank you.
Yeah, I think it's a very good question, because we use a lot of these expressions with, for example, low carb. And low carb for some, it's a kind of Atkins diet, or where you have reduced the content of carbohydrates to maybe 5 or 10% of the total energy. But in the trials I'm alluding to is actually where it's only reduced a little bit, perhaps down to 30% of calories. Whereas, and it's the same when we talk about a low-fat diet. I would say a low-fat diet is something that today is probably 25% of calories or less that are made up of fat. But in some way, it doesn't really make sense to use this as something that is very important cuts off, because the intake of carbohydrate that is tolerated is also depending on the types of carbohydrates. So if you have low glycemic index carbohydrates, you can tolerate much more, both for your blood sugar and also for your body weight regulation. So it's a little difficult to translate into something, but I think not to make it too complicated, I was simply saying that when you're doing your shopping, don't be afraid of the full fat products. Personally, I have changed over the last 10 years to go from all the lean cheeses now to the full fat ones because I can see it doesn't influence my body weight or my blood sugar, and I actually think they are more tasty. But that's my personal preference.
Okay, thank you so much for just highlighting that, because I think many people think when we talk low carb that it's almost no carb. And that's an important thing, yes, because we know of the important impact of our whole grains on our microbiome. And, so perhaps you'd like to touch on that, the impact maybe of the fat intake and the carbohydrates on the microbiome?
Yeah, but I can just say that all the trials we've been running with people with type 2 diabetes, where we can see reducing the carbohydrate and giving them much more full fat products such as cheese and yogurt and milk, but also eggs and chocolate and other things, is that it's extremely important for the compliance. If you tell them that they should eat no carbs at all, you actually see a quite dramatic drop in their blood sugar. It's extremely effective to eliminate carbohydrates, but they cannot sustain this diet for more than, for a trial, maybe for some months. In the long term, they are coming back because they want some carbs. And I completely understand it. So we need to realize that it's not a realistic diet. It might be interesting for research. But actually, when we started to use this, provide them with diets with 30% of calories from carbs and add much more the whole grain and more fiber, we got exactly the same results on their body weight and blood sugar. It really went down, and compliance was much better because now they were allowed still to have quite a lot of carbohydrates, not excessive amounts, but also if they selected the basmati rice instead of the white sticky rice, so you also got a lower glycemic index. It was also allowed. It did not have any adverse, and it also have a very beneficial effect on liver fat, which is probably quite important for the patients with type 2 diabetes.
Thank you very much. The next question I'd like to ask you is in terms of dairy and fat-free mass. You referred to that in your presentation, and we know that many sportsmen nowadays use dairy as a recovery drink after sport, which obviously has a very good effect. I want to ask you what the effect of dairy on fat-free mass is, how it is influenced by physical activity.
Well, Julia, I think, if you're doing training, physically active training and weightlifting, etc., and want to increase your lean body tissue and your muscles, I think all animal protein actually is quite good. I normally tell people you don't really need to buy these very expensive supplements, because all you need is the right amino acid composition. And you can get that very good from dairy. We have various dairy products, cottage cheese, and also a special kind of skyr, which is a Nordic version of a yogurt where the protein is very high. But they can also use eggs or chicken and of course they can also use lentils, etc. But so they really need to mix it in the right way. So they ensure that they get all the right amino acid composition, because it is the animal protein that have the same amino acid composition as we have, as we also are kind of animal. And so it really matches our requirements, whereas if you move into the plant, you need to be much more careful about it. So I think for the adults, it's simply to have animal protein that is good to build up, and also to preserve for the elderly, to preserve their bone and lean body mass. I think for the children, the grown children, there is something special about dairy because there are some IGF-1 that actually seem to stimulate growth. So children with who had a high intake of dairy, they actually are taller than those don't get it. And if you look at my children, I have 4 boys. They are all also much taller than I am. So I think they got probably a lot of but they're quite happy about it.
Okay, because probably the whey protein might have a different impact to other types of protein as well.
Exactly,
Yes.
exactly.
Okay, thank you so much. It's been really exciting to listen to you, and I'm sure there'll be a number of other questions, and you are welcome as an attendee to send those through. I'm watching the questions. I haven't seen any additional ones. I see one more question coming through. Perhaps we can take it before we move on. Someone is asking if double cream yogurt can be used by diabetics or whether it should be avoided. What is your opinion on that?
I see no problems, as long as in a balanced diet, so it's not exaggerated. But I wouldn't. The cream is probably very neutral in terms of cardiovascular risk, and it's also neutral in terms of blood sugar. So I would have no problems.
Thank you so much. Then it's a
Thank
privilege for me just to say thank you. And we have decided to take the questions after each speaker, but we hope you can stay with us. I do know that there is a time difference where you are, but we do hope that you can join us for our very exciting next presentation as well. Okay. Thank you. So now it is my privilege to introduce to you Professor Renee Blau, who's a professor in therapeutic nutrition at the Division of Human Nutrition, Stellenbosch University, South Africa. I'm also privileged to know her very well as a colleague and friend. So it's nice to listen to you this evening, Renee. She is a registered dietitian with the Health Professions Council of South Africa. She's the past chairperson of the Professional Board for Dietetics in South Africa, a past president of the South African Society for Parenteral and Enteral Nutrition, or SASPN, and an honorary member of both SASPN and the Association for Dietetics in South Africa. She's actively involved in teaching and training in dietetics with a passion for mentoring. She strives to fulfill her educational philosophy to stimulate, create interest, and empower others to help themselves. Her main research interests include nutrition support of critically ill patients, hospital malnutrition, and nutritional management of gastrointestinal diseases. Renee, we look forward to your presentation on Not All Fats Are the Same, with special reference to dairy and cardiovascular disease.
Thank you for the kind introduction and the invitation to be part of this exciting discussion. Not all fats are the same. I'm going to talk about the use of dairy with reference to cardiovascular disease. The components that I will address will be briefly the prevalence of non-communicable diseases, cardiometabolic risk factors, consensus dietary recommendations, and where does dietary patterns fit into all of this. We'll then investigate some evidence and try to make sense of all of this before we end up with some concluding remarks. If we look at the burden of disease in South Africa, and we specifically use this document from the National Department of Health, then we'll see that non-communicable diseases amount for about 51% of all the disease burdens in the country. Of those, the biggest would be cardiovascular and cerebrovascular diseases, and some of them come from cancer, as well as diabetes and chronic kidney disease. If we look at the document from the Western Cape Province Burden of Disease Report from 2019. And on this slide, you will see 3 lines. The one indicates stats from 2080, 2013, and 2016. And you'll see that throughout this basically 10-year period, there's been a gradual increase in the prevalence of non-communicable diseases over the course of time in both men as well as in women. If we look at the cardiometabolic risk factors, so the components which we should basically address in order to try and prevent or curb this problem, then you'll notice that it is really a huge number of risk factors. Dyslipidemia, raised LDL cholesterol, a decrease in HDL cholesterol, and an increase in triglycerides on the one hand. In the middle block, you'll see glucose intolerance or insulin resistance. You'll note some form of pro-inflammatory state, hypertension, vascular dysfunction or impaired coagulation. And then on the right-hand side, the lifestyle-related factors. This includes obesity, inactivity, smoking, alcohol, and underlying an unhealthy diet. Of all of these risk factors, the one that's been targeted as the one to try and decrease and focus on is the raised LDL cholesterol. So the assumption is that if we can decrease, or if we can focus on the total fat intake of the diet, specifically on the saturated fat intake of the diet, we can try and see if that can have an effect on LDL cholesterol. And we know increasing total fat, increasing saturated fat does increase LDL cholesterol. We also know that a raise in LDL cholesterol does increase the risk for cardiovascular disease. Therefore, the assumption, if we decrease saturated fat, total fat, we might be able to curb this problem. This was the basis on which most of the international dietary guidelines for the prevention of this problem was actually based on. So control dietary fat intake, and specifically with regards to saturated fatty acid, decrease it to less than 10% of the total energy intake. Nowadays, as you know, we use healthy dietary patterns, or we talk more about dietary patterns or groupings instead of using individual foods or nutrients. Now, if we look at an example of a healthy dietary pattern, and on the slide, you'll see that it contains a higher intake of fruit, veg, whole grains, low-fat or non-fat dairy, seafoods, nuts, and legumes, and then a moderate intake of alcohol and the red meats. But the focus here is on low-fat or non-fat dairy. For the South African guidelines, this is the 2018 updated version of our South African dyslipidemia guidelines. They state that the healthy diet is one of moderation, that is nutrient dense, and it emphasizes fruit, veg, whole grains, legumes, nuts, and then it limits the consumption of refined grains, processed foods, sodium and sugar, and saturated and trans fats. You'll note that it is more vague in terms of limiting saturated fat and trans fats, and it does not specifically mention dairy as a food group in how to address this problem. So if we look at some of the evidence regarding dairy and cardiovascular. So what I've said to you previously is that the international guidelines were based on the assumption that if we decrease fat, specifically saturated fat, we might be able to decrease the increase in the LDL cholesterol, which ultimately could decrease in cardiovascular disease. But does this affect all fats? And specifically, if we use dairy as the example, what does the evidence tell us? This study was done specifically on cheese consumption and the risk for cardiovascular disease. And collectively, they've included the results from 15 different studies, and the mean duration of intake was 10 years. So it's quite an extensive study that was done. And they looked at the effect of cheese consumption on the risk for NCDs, cardiovascular, coronary heart disease, as well as stroke. If you look at cardiovascular disease in the cartoon on the right-hand side, you will note that the relative risk to develop cardiovascular disease, if you compare the highest intake cheese consumptions with the lowest intakes, the relative risk decreased by 10%. For coronary heart disease, it was 14% reduction, and for stroke, again, it was a 10% risk reduction. So the authors of this study say that this talks to the protective effect of cheese when it comes to risk for coronary heart disease. Another fairly recent systematic review that was performed where they included 27 different studies, and this was all studies published until the period of 2014, and they looked at the relationship between total dairy intake and cardiovascular disease. On the left-hand side, You have the cartoon that indicates cardiovascular events. On the right-hand side, it indicates events for stroke. And in both cases, they've got incidence as well as mortality. And collectively, they talk about the events, which is indicated at the bottom. So for cardiovascular events, over a course of time, dairy intake decreased the reduction by 10%. And for stroke, dairy intake decreased the reduction or the stroke incidence by 12%. So again, showing the inverse association between total dairy, cardiovascular disease, and stroke. So basically talking about the protective role of dairy yet again. This highly impressive study was published fairly recently. It includes data that was published in the general domain up until April of last year, and collectively it talks about 37 different meta-analyses that was included in this database. It's a massive piece of work. And in this systematic review, they address all the various components of dairy foods. So here you have an example of what the tables look like, and obviously the detail is too much to project on the slide. But if you note at the top, they have 3 columns. The left column indicates a neutral relationship. The middle column indicates an inverse relationship. That means risk reduction. And on the right-hand side, we have a positive relationship. That means risk increase. So for milk intake, which is the first one, you will note that basically all of the slides fall in the category of a neutral relationship. If we move to, or maybe just before we move on, here just note that on the right-hand side for risk increase, there's nothing, which indicates that there's no evidence associated with any form of harm. If we look at fermented foods, you'll note that basically all of the studies are either neutral or protective, so a risk reduction. If we then move to cheese, there you'll again note quite a few studies on the left-hand side, which indicates a neutral reduction, but you'll also note more activity in the middle, which indicates the protective effect of cheese, which alludes to also what I've mentioned previously. But then you'll also note that there are a dose response component that comes in, talking about a 10 grams per day, a 20 grams per day, and a 50 grams per day, and a risk reduction. And I'll come back to that when we talk about the dose response effect. So we started off by saying that the international guidelines were basically based on the premise that if we reduce fat intake, specifically saturated fat intake, we might decrease LDL cholesterol and ultimately decrease the risk for cardiovascular disease. The evidence that I've shown you, specifically using dairy as the example, did not show that. Basically showed the opposite. It showed that dairy, which we know is very high in fat, actually has an opposite effect and a protective effect. So why is this? And I'm just going to talk through 6 potential explanations or examples to try and make sense of all of this. The first talks to the food matrix, and we've already heard about this food matrix. And let's take cheese as an example and unpack the nutrient composition or the nutrient matrix of cheese. So yes, it is high in fat. And yes, 60% of the fatty acid composition in cheese is saturated fatty acids. So the logical assumption would be cut out cheese, specifically the high fat ones, and you will end up with a positive outcome. And I've shown you the opposite to be true. Why is that the case? And that is because of all the other nutrients that's also packed into dairy, and in this case, specifically the example of cheese. Each of these individual nutrient compositions directly impact on one or more of the cardiometabolic risk factors. So either individually or in a synergistic collective effect, they address dyslipidemia, glucose intolerance, or increasing insulin resistance, definitely have an anti-inflammatory impact. They affect vascular dysfunction, clearly obesity through the satiety effect, clearly hypertension. Indirectly, you could also say that they could address inactivity, smoking, and alcohol, not by saying that eating a piece of cheese will cause or will result in smoking less, but evidence is very clear that the moment people start to think more about their diets and about what they eat, it also impacts on their lifestyle and it results in a more healthy lifestyle. Let's look at particle size. Saturated fat, 60% of that we find in dairy. It does result in an increase in LDL cholesterol. That is a fact. However, the size of the LDL particle differs. And in this case, it results in the formation of large LDL particles, not in the smaller, dense LDL particles that you'll find with other fats. These larger particles are less atherogenic and clearly also not linked to cardiovascular disease, and probably because they have a higher affinity for the LDL receptor and they are less susceptible to oxidation. So if we only measure LDL content in the blood, yes, it will be raised. But if we look at the actual particle size, we'll note that it's the larger particles, which could be one of the explanations why we find the opposite effect of what was expected. This is a relatively busy slide, but the message that I want to bring across is that when we read the literature and when we try and understand the various findings, we should also look at what the comparators are. So whenever there's two different groups, how do they compare the one with the other? So in this study, they replaced 5% of energy from dairy fat with an equivalent energy source from another source. So remember, dairy fat is animal fat. So if you replace that with 5% vegetable fat, they found a 10% risk reduction. Makes sense. You exclude animal and you convert it to vegetable fat. If it was replaced with a polyunsaturated fat, omega-6, 24% risk reduction, and replaced with carbohydrates, specifically your whole grains, 28% reduction. So this makes sense. But I want you to look to the right-hand side. If you replace 5% of dairy fat, which is an animal fat, with another 5% of another animal fat, there's actually an increased risk for coronary vascular disease. So again, not all fats are the same, not all fats respond the same in the body. The prevalence of inflammation or low-grade inflammation could be another reason that we have to investigate to try and understand why do these things not necessarily follow the anticipated outcome. So we know that all of the chronic diseases of lifestyle have an underlying low-grade inflammation. Secondly, we know that the saturated fats in dairy have pro-inflammatory effects. So again, one would assume that there would be that direct association between dairy intake and inflammation. However, intake of dairy leads to reduction in all of the parameters indicating inflammation, C-reactive protein, tumor necrosis, interleukins, all of them. And it actually speaks to either a neutral or even an anti-inflammatory effect. And this was confirmed by a very recent systematic review of 16 different studies where they investigated healthy individuals as well as those with metabolic syndrome and type 2 diabetes. And they determined the effect of dairy intake on inflammatory markers. And they found no pro-inflammatory effect associated with the consumption of milk or dairy, and even a weak or sort of anti-inflammatory effect over a long-term intake. Second to last is the role of fermentation. So yet again, fermentation can directly impact on reducing inflammation. So platelet activating factor is a pro-inflammatory phospholipid. And we know that dairy contains platelet activating factor inhibitors. And as the level of fermentation increases, this platelet activating factor inhibitor activity increases. So the more fermented dairy products, the bigger the anti-inflammatory effect. I've already spoke about this unique nutrient blend that we have in fermented products, for instance, cheese, and about the synergistic or the collective effect. And then lastly, they're just talking about bacterial fermentation. So we know bacterial fermentation results in the production of short-chain fatty acids, specifically butyrate, and they are linked with a host of positive health benefits, not just improving localized gut health, but also regulating cholesterol metabolism, regulating appetite, and clearly proven anti-inflammatory properties. So lastly, then back to the dose-response effect. We've shown that with cheese intake, there's a nonlinear association and nonlinear inverse association between the intake of cheese and the risk for cardiovascular disease. And in this specific study, the largest risk reductions occurred at a consumption of about 40 grams of cheese per day. Back to the systematic review that I referred to earlier, and I mentioned to you that the various portion sizes indicated a specific risk reduction. 10-gram portion size a day, 2% risk reduction. 20-gram, 4%, and a 50-gram portion per day resulted in a 10 to 14% risk reduction. So the greater portion, the greater the risk reduction that they found in this very impressive study. To put this into concept, so a 20-gram portion of grated cheese is about the size of a tablespoon, whereas a 50-gram portion of grated cheese is about the size of a serving spoon, or you could say it's about a third of a cup grated cheese. So that gives you an indication of the portion size. So this study then continues, and they basically summarizes to say that in healthy individuals with a normal serum cholesterol, they recommend a total dairy intake, whether it's full fat or low fat, of up to 200 grams per day. For milk intake, the recommendation is up to 200 ml a day. So that's basically a good glass of milk per day. For yogurt, the recommendation is up to 200 grams. So it's basically 2 of the smaller tubs. And for cheese, as mentioned, the recommendation is up to 50 grams per day. So lastly, just looking at the global nutrition report and trying to understand the food intake globally. Now, again, very busy slide, but you can focus on the yellow bars, which are the bottom bars on all of these graphs. So at the bottom, they have the various continents. The African continent is the second set of bars where they compare the 2010 data to the 2018 data. And then Europe, you'll find sort of more or less in the middle of the slide. And then, as I've said, the dairy is indicated by the yellow at the bottom. And the y-axis indicates the food intake per person in gram per day. And on average, globally, the intake of dairy has decreased by about 7% over the course of this 8-year period that they portray the data. But for the African continent, you'll note that on average, the dairy consumption per person per day was about 100 grams. In the case of this specific study, they used the dairy as milk equivalent, so 100 grams, which is half of the recommended values that we've just looked on at the previous slide. So to conclude, the intake of dairy products provide different results from what we expect. And it most probably has to do with the fat content and specifically the source of dairy and this absolutely unique food matrix with the synergistic effects of all of the nutrients. Total dairy intake as a risk factor for cardiovascular disease seem to have either a protective effect or a neutral effect, but clearly no harmful effects have been shown. And the focus on the guidelines to have low evidenced dairy intake is just not evidence-based because there's no proof that the low-fat dairy intake within the recommended intake levels is harmful. And I would like to use the conclusion of this specific systematic review as the last word, because I believe that they really summarize the literature quite nicely. And they say the results indicate that the association of dairy with cardiovascular disease is largely driven by the food type, cheese, yogurt, milk. And these findings may inform dietary recommendations for cardiovascular disease prevention by allowing healthy individuals with a normal plasma cholesterol a more liberal consumption of up to 200 grams per day of total dairy. And then also they say irrespective, again, of the fat content. Within this amount of consumption, fermented dairy products should be preferred, and they recommend a generous serving of yogurt per day or 3 small servings per week of cheese. I thank you for your attention.
Thank you so much, Renee. We've had a lot of interest in your presentation, and I mean, even I have really a couple of questions that I'd like to ask because it's been an absolutely really thought-provoking presentation. So thank you so much for that. I'm going to start with a question that's about the recommendation that you made. You said that the recommendation for dairy intake applies to healthy individuals with a normal serum cholesterol. What about those with raised cholesterol levels?
I can give you the short answer or the long answer. The short answer is, I don't know. So to go to the long answer, I think it's because, I mean, I referred to the specific systematic review, and it was their recommendation, and all of the studies that we have in the literature were actually done on their healthy population. So we cannot necessarily just infer and assume that the data can move forward from their healthy to maybe the person with high cholesterol. But I would think, also listening to Prof. Arne's talk just now, there is no one message. I think for me that is the daunting task of being a dietitian in this day and age, but also the exciting task is the fact that we have to be able to adapt personalized nutrition according to our patients. So I would say, given the fact that we don't have a consensus document like we have for the one that I've alluded to, for the patients with high cholesterol and maybe all the other associated comorbidities, in that case, you have to probably just take a step back and ask yourself, well, you know, what are the other risk factors? What are the other problems? Most likely also taking into consideration that the patient might be overweight, and then you might want to look at the total energy content of your diet, start playing with not just the fat, but also bringing in low GI carbohydrates, etc. So I would think, definitely still consuming dairy, because I mean that is a given, and with all the massive nutritional benefits of dairy, we should continue to consume that. But maybe play around with low fat, in some cases higher fat, combine it with fiber, combine it with low GI, and test it out and see how the patient actually responds.
Thank you, Renee. Now, I've got a number of other questions. I'm going to mention them to you, and then we're looking forward to hearing what you have to say. There was a question at the end of Renee's presentation that I do want to ask you as well, that we didn't answer, we didn't actually ask at that stage, but it's very relevant to what you've presented as well. And that is, what is your opinion on meat fat? So high fat in terms of meat and lean meat in this context of saturated fat.
Mm-hmm. Again, quite a difficult one to give a yes, no, answer. If you recall the one slide that I've shown where they looked at various comparators, where if you take away 5% of dairy fat and you use 5% of total energy from another source, then you get a different specific outcome. In that specific study, where they've changed dairy fat to a 5% equivalent animal fat, they found an increased risk for cardiovascular disease. However, they did not specify whether it was lean meat, whether it was this or it was that. They just grouped it as animal fat. So it is difficult to directly answer to say that all animal fat, if that is the alternative, would have the same effect. But based on that study, that was the case. So I think my best response would be, again, and I'm going to use one of the words that Arne used in his presentation. He talked about the magic of food, and I really like that word, because again, it just shows that due to the unique food matrix, different foods have different food matrices. They respond differently, and we should not be scared to play around. And I mean, it's all in portion size in any case. I mean, we're not talking low fat, high fat meat, 600 gram portions. We're talking still relevant recommended portions. So I would think, and I'm talking on his behalf, but I would think, based on also on the evidence that he's shown to us, that it is fine, that it is acceptable, that the evidence is there to show that it has protective effects. But just look at the bigger picture and look at the total diet. And not just at a single nutrient.
Okay, thank you. I'm thinking again of ETSA's logo of a couple of years ago that said all foods can fit. So if your whole diet consists of meat, it's not a healthy diet, but it doesn't mean that meat can't be consumed at all. Renee, we've had a very interesting question here that's asking about the difference between the intake of long life versus fresh milk products. If there's a difference.
I have to say I don't know. In none of the systematic reviews or studies that I've looked at that they specify in terms of the shelf life. They specify it in terms of higher fat, lower fat, fermentation products, etc. But none of the categories were specifically for in terms of shelf life. So I actually cannot really answer that one. I would think that it has more to do with the fat content, with the I don't think the shelf life. I might be totally wrong, so I don't know. And maybe our colleagues from Rediscover Dairy can on their website provide if I'm totally wrong with this one.
I think that's a very good suggestion, and I'm going to really, we do have the person that's asked the question, and we're going to ask our colleagues from Milk SA just to reply to that as well, because I think you work with it every day. There's another question that is about the percentage of energy from the macronutrients. So we mentioned that percentage of energy can go as low as 30% of total energy for carbohydrate, and then 35% fat. So the person is asking, is that 35% protein then? If you're working towards 100%. So perhaps just looking at the macronutrient distribution.
Yes. Yes, I think I don't. I think the percentages that were given were mixed up a little bit. So normally what we look at when we talk about low carbohydrate, that it can go down to about 40% of carbohydrate, which then means that the fat normally goes up to about 35 to 40%, which means for your protein, you still remain with about 20% of protein. On the other hand, if you have a carb, which can be anything up to 60-65%, your protein remains plus minus 20, and then your fat becomes the balance, which is the small percentage. So when you talk about the low carb and the lower fat, then that was actually the two opposites, and then you have to look at what is the rest of the composition to make up your 100. So your protein in basically all of the studies that I've seen, and it's throughout with diabetes and all of that, it's very, very, very seldom that you should exceed 20% of your total energy for protein.
So now, I think this question was asked before you started describing the portion sizes. So you did include that in your presentation, but there is a second component to the question. So I am going to ask it from you or to you. They say, what is the total dairy intake included in terms of milk, yogurt, cheese? Was it low fat or high fat?
Okay, it was all. So the recommendation. I know that you were not able to see the detail on the slides because, as I said, the tables were fairly busy. But for instance, that one table that I had with milk, it had high fat milk, low fat milk, total milk, all of them underneath each other in the various categories, and they all fell in that specific case of milk, for instance, in the neutral column. So for the cheese and for the fermented products, they were all lumped together. So they did not make any distinction between high fat and low fat when they made those recommendations, and that's why also in that summary section that I borrowed from this article, because I really like their wording, they specifically say it does not matter whether it is higher fat or low fat, as long as it's dairy with quantities of up to 200 grams per day, as I've mentioned.
Thank you. Right, then our last question is a very simple one that says, what about butter?
So butter is obviously, as you heard, not myself or Anna actually discussed butter, because strictly speaking, it's sort of a slightly different category for dairy. So I'm not going to go into the butter at this point in time, because it has a slightly different impact and different studies, and it was not part of the dairy ambit that I studied for this specific one.
Yeah, I suppose I've also, in the studies that I've seen, very seldom do they refer to butter as a dairy food, or ice cream, or any of those kind of foods that do have dairy components that have a much higher, you know, content of a certain macronutrient, like the fat in butter
100%.
and even in ice cream as well. So I think that's a little bit different. Okay, but thank you also for touching on the fermented dairy products, because I think that's an important component. And again, there the carbohydrate element is important when we're looking at the probiotics that need the prebiotics. And we also know about the important function of lactose as a prebiotic in milk and in enhancing health as well, with a lot of positive effects as well. Okay, I'm just going to, I see someone's asked about cream now, it's just come up. And I think cream falls in the same category as butter and ice cream or something like that would fall. Would you want to add anything about cream, Renee?
No, I think, no, it's definitely in the same category. So it was, you know, it's not part of any of the systematic reviews done on dairy foods per se. You will not find those categories. So it will be individual studies that was done with those.
Okay, thank you very much. Then it just remains for me to say thank you for really a most entertaining, very well prepared and informative presentation. We really have enjoyed it this evening. And then I'd like to hand over to Marietta to say the last word this evening. Thank you so much to everyone that was able to join. Bye-bye.
Thank you, Karina, for the moderation and the two brilliant presentations that we had. This will bring us to the end of our event. Many thanks to everyone who listened and participated today. From the project side, we trust that the information was valuable and that its application can make a positive contribution to your work environment. I would like to re-emphasize that participants will receive 1 CEU for attending the full webinar. All local delegates, CEUs, will be submitted directly to the HPCSA. You will receive confirmation from the HPCSA that your participation has been submitted. Unfortunately, this does not apply to viewing the recording afterwards. Also remember that you can earn another 2 CEUs by reading the CPD article on the Rediscover Dairy portal and completing the questionnaire. You will have to register on our CPD portal, and you can do so by visiting our website at the Rediscover Dairy and click on the Dairy Matrix CPD banner, or follow the prompting from the CPD for dietitians and nutritionists menu item. You can also use the link as provided on the slide to access the portal directly. Right, so this is what the CPD registering portal looks like. Once registered, please make sure that you complete your portfolio correctly and provide us with a correct HPCSA number. The system can only use the information that you provide. To access the article, go to your dashboard and scroll down to CPD articles. Open the pop-up menu. Here you will see Dairy Matrix CPD event. Click on this item. You will now see the article, and you must download the article. Once you have downloaded the article, a blue start button will appear on the right-hand side. If you click on the start button, the questionnaire will open up, and you have to be online to submit your answers. On submission, you will receive confirmation, a confirmation email and your CPD certificate. But the Consumer Education Project will, however, submit your certificate directly to the HPCSA, after which you will also receive a confirmation email from HPCSA that your points have been uploaded. So I hope this makes it easier for you to access the article, and also if you want to go and have a look at the recording of our webinar. Thanks again for watching and joining us, and have a good evening, afternoon, or rest of your day.
Yes, thank you, Marietta, for the thank you. And from Food Focus side, we also just want to say thank you. And absolutely well done, Christine, to you and your team. I think it was amazing presentations with a load of information. And I just want to mention to everybody that a recording, as well as the slides, the presentations, will be available on our website on www.foodfocus.co.za, as well as on Rediscover Dairy's website, .co.za. Please, after the end of the webinar, there's a short survey. It's about 3 minutes. It's 12 questions. Please, would you answer this, because this, at the end of the day, provides us with information, making sure that we can provide you with webinars with relevant topics. I thank you and enjoy the rest of your day, and goodbye.